Dr. Christy Ennis. Today, if you have creaky, cranky knees, we are going to get you 5 exercises all seated, help you feeling better. And seated because more often than not, that's when our knees actually get creaky and cranky when we go to stand up. So even today, before you stand up, you're going to feel a lot better. Exercise 1, for all of these, try to get to the edge of the chair a little bit. But you're going to take and you're just going to kick one leg out and you're alternating here. If you think about sitting up nice and straight, you can engage those abs too and get a double whammy here. But this is great if you have been sitting, it's getting that flow going. You're only going to kick out as far as you can comfortably. You only have to do a few at a time. If you want this to be a little bit harder and work those quads and hip flexors even more, when you straighten out, then go ahead and add a little lift in. And this really is a lot harder, and it's a lot harder to stay upright too. And then if you want to make it harder in another way without adding that little lift, if you put a band around your shins or around your ankle and do the same thing, you'll get more of a workout that way. Right, our next one, we're going to go the opposite direction. So if you've been sitting with your legs straight out, or even if you haven't, you do want to start with them now a little bit more forward. And now we're going to take and we're going to pull one foot back and then pull the other foot back. You can stay there, or if you want to add a little bit more oomph to it, you're going to add some hip motion too. So I'm going to pull back, I'm going to rotate one way, rotate the other way. Notice I'm not shifting and leaning, right? We're just working on getting that hip rotation in both directions because that's important for the knee. And then lastly, if you want to make this even a little bit harder, I'm going to show you how to do that. You can do it with a band. All right, to do this with the band, same kind of spot as with the leg extension, but now you're going to put one foot a little bit more forward so you have a little bit of resistance, and now I'm going to pull back. So you can start with just that little pull back, or you can add that hip motion onto it too, and then you actually get some resistance in through that hip motion. All right, we're going to go right up onto our toes, so we're activating those calves, which also play a role in that knee. So this is kind of level 1 here, and it should feel good. If you want to get a little bit more out of it, you're going to add a circle as you come up. So I'm coming up onto those toes, circling those feet and those hips a little even around and coming back down. So up, circle, and down. And then if you want to work your brain too, switch directions and go the other way. Working those inner thighs, right, which come down and attach at the knee on the inside. So if you make 2 fists and put them right on those inner thighs, and I'm going to squeeze my legs in as my fists are pushing out. Look at that, I get a little arm workout too. Make sure you breathe, hold for about 5 or 10 seconds. You have complete control of how hard you're pushing. So if you're feeling not so great today, don't push too hard, right? Just get a little push. And then I'm going to show you a way to make this one a little bit harder too. To make that one a little bit harder and a little bit more dynamic, if you straighten one leg out and think about kind of rolling those toes out just a touch, and then you're bringing that leg across the body so that we're really, again, working that inner thigh, but with a longer lever arm makes it even harder. And if you want it to even be a little bit harder, then you can go ahead and add a band on as well. Last one, working those outer hip muscles, which help support the outside of that knee. So again, you can take those hands and you're going to push your hands in and your legs out. So we're getting another isometric contraction here. And there's a couple ways to make this one a little bit harder. So even if you just stay with that isometric contraction, if you bring your body forward and then add that push and do about 10 or 15 there, and then go ahead and lean back, you're getting different angles of the muscle, so that will be a little bit harder also. And then you can take a band again to make this one hard as you just pull those knees out and back in.